Hola, I'm Mae Silvestre, and I'm your student nurse. I will show you the steps, the intervention, and the procedure of the postpartum maternal physical assessment. The purpose for this assessment is to purely assess a postpartum mother, thereby preventing complications after delivery. Let's begin. The first step is to identify the correct patient. The second step will be introduce yourself and state the purpose of the intervention. And this is an example. Good morning, Mrs. Cruz. I'm Sarah, your student nurse for today, starting from 12 noon to 4 p.m. The doctor ordered me to conduct a postpartum maternal physical assessment. Is that okay, ma'am? Yes, it's okay. And the third step, provide for the client's privacy. The fourth step, set the bed to a comfortable height to work and lower the side rails where you will work. The fifth step is do wash hands. The sixth step is check the mother's vital sign and record. The seventh step, wear gloves, clean gloves, to prevent the transmission of microorganisms. This picture shows the mnemonics in maternal assessment, which, in short, it is a bubble HE or bubble HE. Breast assessment is the first letter in our mnemonics wherein we will palpate both breasts for engorgement or filing, and also we will minimize palpation for bottle feeding mother to avoid stimulation. And of course, check nipples for pressure sores, cracks, or fissures. And we will evaluate whether nipples are everted, flat, or inverted. And the enlargement, that is usually occurs 2 to 3 days postpartum. Remember, all mothers should wear a supportive bra 24 hours a day for the first few days postpartum. The eighth step is position the client in a supine or sitting position. The ninth step, open the gown, exposing the breast to be examined. And the 10th step, inspect for the following: the consistency, nipple type, and integrity, swelling, redness, engorgement, and tenderness. And for the 11th step, tie the gown. And for the second letter in our mnemonics, it is the uterus assessment. It is the fundus is palpated for the following. Number 1, the height. Record fingers width above or below the umbilicus. For example, fundus descends 1 finger breadth each day. So that's an example of height. Number 2 is the position. Fundus should be midline, near in the umbilicus. A full bladder may push the fundus to the right or left of the umbilicus and cause to be heavier. Number 3 is the tone. Fundus should remain firm. If the uterus becomes baggy, gently massage the uterus to help the muscle to contract. Let's move on to the 12th step. Expose the client's abdomen, covering the upper part and the lower extremities. The 13th step, assess the tone, height, and location of the fundus, which is the pubic height. Immediately after birth, at the level of the umbilicus, 1 to 2 hours after delivery, midway between umbilicus and symphysis pubis. 12 hours after delivery, 1 centimeter or 1 finger breadth above the umbilicus. 24 hours after delivery, 1 centimeter or 1 finger breadth below the umbilicus. 24 hours after delivery, 2 centimeter or 2 finger breadth above the umbilicus. The 72 hours after the delivery, 3 centimeter or 3 fingers spread above the umbilicus. For the third letter in our mnemonics, it is the bowel assessment. We will assess for the presence of vowel sounds. We also palpate the abdomen for distension and administer daily stool softener per doctor's order. We also avoid use of enemas and or suppositories for the patient or for the mommy with a 3rd or 4th degree laceration. If needed, use with caution. Usually, the first bowel movement occurs on or after second postpartum day. And the best for patient or the mommy to have a bowel movement is before discharge, but may not happen. No? Often sent home with stool softener and encouraged to eat fiber and also to get an exercise. The 14th step, ask client whether she moves her bowel or not, or whether flatus is positive or not. For the 15th step, a useful date for bowel sounds. And for the 16th step, assess for abdominal distension. And the 4th letter in our mnemonics is a bladder assessment. This will accompany the mother and record first 2 voidings. We also palpate for distension above the symphysis pubis, and if the patient or the mother has not voided in 68 hours post-delivery, we, the nurse, straight cat per doctor's order and or notify doctor for any voiding difficulties. Be also alert for signs and symptoms of UTI or the urinary tract infection, like for example, infrequent voiding, painful urination or dysuria, burning, frequency, urinary retention, and post-smelling urine. And for the postpartum voiding difficulties related to fatigue, perineal swelling, long difficulty labor and delivery, for example, use of forceps, vacuum extractor, and so on. For the 17th step, ask client for the voiding pattern, presence of pain or burning sensation during urination. And the 18th step, palpate for bladder distension. The 19th step, track fluid balance, intake and output. And for the 5th letter in our mnemonics is lochia assessment. In this assessment, we will assess the peripad daily, the color, the amount, the type, and for any full odor. And we also instruct the patient or the mother to notify the nurse if she passes clots. Note the size and number. Always remember, call the doctor for any excessive bleeding. And the 20th step, assess the amount of lochia, note time of last perineal pad change. Take note for the amount of lochia on perineal pad. It may be scant, small, moderate, and large. And if waiting perineal pads, it is 1 gram is equals to 1 milliliter of blood loss. And the 21st step, assess the number of days the woman has delivered her baby. The type of lochia or vaginal bleeding is based on this. The first one is lochia rubra, which is 1 to 3 days, blood is red in color. The second one is lochia serosa, which is 4 to 10 days. Vaginal discharges are brownish pink in color. And at last, Loci alba, which is 11 to 21 days, vaginal discharges are yellow to white in color. And for the 22nd step, document number and size of blood clots. And for the 23rd step, remove medical gloves and do hand hygiene. And the last but not the least in the letter of mnemonics is the episiotomy or episiotomy assessment. In this assessment, we will assess using RIDA. R stands for redness, E stands for edema, E stands for ecchymosis, and D it stands for discharges, and the last one is approximation. We also assess the position in lateral Sims position with upper knee bend, gently lift the buttocks to VA perineum. We also use the flashlight and it will be helpful. And also apply ice bags if ordered for 6 to 8 hours post-delivery to minimize swelling. And we also assess for presence of hemorrhoids. Teach the patient or the mother to apply medication as ordered. And remember, most women deliver with an episiotomy. Episiotomy as follows. Number 1, midline. The second one is right or left mediolateral. The third one is third degree extension, which is laceration extends to the rectum. And at last is fourth degree extension, which the laceration extends through the rectum. The 24th step, wear sterile gloves to prevent the transmission of microorganism to the mother or to the patient. And 25th step, place the patient in lateral position with her back facing you. And for the 26th step, expose the client's buttocks. And for the 27th step, inspect for the following: redness, edema, ecchymosis, number of stitches, consistency of discharge, and approximated edges, in short, RIDA. And for the 28th step, palpate the edges of the stitches using either of your thumb or index finger, noting for the presence of discharges for the stitches and pain upon palpation. For the 29th step, dispose or arrange used materials properly, do hand washing. In the 30th step, record all the data in the client's chart. Always remember to refer any abnormal findings to the attending physician.